희망 같은 거 갖지 마요.
What is Crohn's disease? Crohn's disease is a type of an inflammatory bowel disease that occurs at the colon and small intestine, becomes swollen and irritated. All layers of the intestinal wall are affected by inflammation, which also spreads to nearby lymph nodes and supporting membranes. As the inflammation penetrates into the peritoneum, fibrosis thickens the intestinal wall and narrows the lumen, leading to the formation of ulcers. Did you know? Another commonly diagnosed as IBD called as ulcerative colitis.
Let's move on to the pathological disorder related to Crohn's disease, which is intestinal obstruction. It is a functional or mechanical blockage of the alimentary canal. What is meant by functional blockage? Functional blockage occurs when the muscle of the intestinal wall fails to contract normally in the wave-like sequence peristalsis that propels the intestinal content. While mechanical obstruction include a narrowing of the channel structure, adhesion, tumors, and the presence of foreign object, pressure from outside, hernia, volvulus, and intersubsection. In a hernia, a loop of intestine protruding from the abdomen may be compressed at the point where it passes through the abdominal wall. A volvulus is like a twisting of the intestine upon itself, and intersubsection is the telescoping of the sections of intestine into an adjacent portion. The loss of fluids and chemicals through vomiting is frequent with obstructions that are located high in the intestinal canal. Obstructions of the lower reaches of the small intestine ileum and of the large intestine are inaccessible to evacuating by vomiting. In such cases, the intestine above the obstructions become distended by accumulated material and swallowed air. The pressure in the intestinal channel may compromise the blood supply and cause death of the tissue in the wall of intestine, and the wall may become abnormally permeable, allowing noxious agent to escape into the abdominal cavity and the bloodstream. Next is anal fistula. It is a deep source or ulcer within the intestinal tract may turn into tract called fistulas. Having a fistula means a thin passageway has formed between the gut and the skins or another organ due to the perianal corrosions by enzyme. They may affect the loop of the bowel, bladder, vagina, and perianal skin.
Hi, I would like to continue about the pathological disorder of Crohn's disease. Crohn's disease began with crypt inflammation and abscesses which progress to tiny focal ulcer. This mucosal lesion may develop into the longitudinal and transverse ulcer with intervening mucosal edema, creating a characteristic gallstone appearance to the bowel. Crohn's disease can increase risk of cancer that affected small bowel segment. Patients with colony involvement have a long-term risk of colorectal cancer that's similar with ulcerative colitis. Patients with Crohn's disease are also at high risk for large bowel, small bowel, extraintestinal, gastrointestinal, and hemophagocytic cancer. Last but not least, Crohn's disease also having chronic malabsorption. But wait, what is malabsorption? Malabsorption is disorder that occur when people are unable to absorb nutrients from their diet, such as carbohydrate, fats, protein, mineral, or vitamin. Malabsorption can occur if someone does not have enough digestive enzyme, bacteria, or other foreign invader are present, or movement in the small or large intestine is faster than usual. Inflammation can cause difficulty digesting and absorbing nutrients. Chronic malabsorption can cause nutrition deficiency such as vitamin D, B12, calcium, and iron.
Good morning, Miss ILYANA. I'm Dr. Shaza. Why are you here today? Are you alright?
Why did she ask me that silly question? I'm severely ill right now, of course. Can't you even see my pale face here portrays as living dead? Oh God, help! Be gentle, ILYANA, please. She can aid you. Bear that in your mind.
Alright, here, Dr. Shaza, I have to let you know that my tummy is severely aching right now. My faces occasionally contain mucus and blood, and I frequently alternate between constipation and diarrhea.
Is it food poisoning? But it is not confirmed yet. Can you tell me when the abdominal pain started? Is it yesterday?
It's been a week already, doctor.
Why do I think it's either ulcerative colitis or Crohn's disease?
I first noticed a severe reduction in my appetite, followed by an unpleasant stomach.
I think you have a problem with your gastrointestinal tract, so I need to do a complete blood test and the stool test to look for sign of intestinal inflammation.
Okay, doctor. Perhaps it's not a chronic disease.
Then you may follow my medical assistant to do your assessment.
Hello, miss. I'm Lily Sweet. You may call me Lily.
She will give you anti-inflammatory medicine to minimize the irritation. Please come again for the next couple of days for the disease test results.
Okay, doctor. Thank you. Hello, doctor. What about the diagnosis from the prior days?
Oh gosh, I'm extremely nervous. Mom, I want to go home. Mom.
Miss ILYANA, I'm sorry to announce that you have an inflammatory bowel disease called Crohn's disease.
Now, let's take a look at the clinical sign of Crohn's disease. Although any part of the GI tract can be affected by Crohn's disease, the large and small intestine most commonly occurs. The area of the GI tract that is affected can influence the severity of the symptoms. The symptoms may appear gradually over time or they may appear suddenly, and these can include diarrhea. Diarrhea is one of the most common and troubling symptoms for people with Crohn's disease. It's a condition when the lining of the intestine becomes irritated and unable to absorb all liquids during an IBD flare-up. Stool as a result become loose, watery, or even fully liquid. Additionally, the looser stool may pass through the colon more quickly, resulting in more frequent bowel motions. Frequent diarrhea and urgency, rectal bleeding from the anus, and cramps are more common in those who have significant inflammation of the colon, which is large intestine or small intestine. Blood in the stool is common when there is diarrhea in ulcerative colitis, which will cause anemia. This is because when you suffer a long term of diarrhea, ulceration can occur on intestine, which may lead to hematochezia or melena. For your information, melena is digested blood in stool and hematochezia is a fresh blood in the stool. In effect, loss of red blood cell in the blood circulation. Moving on to the causes of diarrhea. Diarrhea may be caused by the bacteria or parasite that can be found in the food and water, for example, E. coli. Well, that's all from me. ILYANA will continue this presentation with another clinical sign of the Crohn's disease.
Thanks, AFIQAH. I will now go over another significant clinical sign you ought to aware of, where abdominal pain is a marker of this Crohn's disease. Yet why? Because this illness is a form of inflammatory bowel disease. Your digestive tract, particularly your small or large intestine, may become swollen and inflamed. There are various kinds of Crohn's disease, but this stomach pain is correlated with ileocolitis. It is the form of Crohn's disease that is most prevalent. It explains why and how the stomach and the duodenum at the tip of the small intestine are inflamed and irritated, and as a result,
The patients may experience discomfort or cramping in the lower or center right area of the abdomen. Actually, there are numerous reasons for abdominal pain, some of which are graver than others. Can you visualize experiencing the sensation that stomach ache may originate from a different abdominal organ or from somewhere other than digestive system? Such a torturous life. The most frequent cause of this pain is swelling of the tissues in the digestive tract. Anywhere in the region of the belly between the ribs and the pelvis will be discomforting to the patient. I'm absolutely aware that, like me, you are also assumed that abdominal pain was a stomach ache which only afflicted the stomach area. But other organs could also be the cause, such as the pancreas, liver, and the gallbladder. Nonetheless, soreness might also arise in your skin, muscles, or abdominal wall of your abdomen. Likewise, the pain that you feel in your belly may also be coming from somewhere else, like your chest, pelvis, or even your back. It may also feel mild or severe, dull or sharp, burning or achy, and constant or intermittent. In the essence, abdominal pain is indeed a subjective illness that only you can experience, but there are instances when you are unable to express how it feels. Thus, if you experience all of these clinical indications, you should immediately go seek medical care for further treatment.
There are some studies that suggest nutrition is important, and as with any ongoing illness, it is vital to keep the body nourished. In these cases, patients are advised to have a specific carbohydrate diet and limit their fiber intake. Firstly, specific carbohydrate diet. This Chron'S disease diet has gained popularity as a nutritional supplement. The basic rule of this Chron'S diet are to avoid specific carbohydrates such as starch and disaccharide, which is double sugar molecules. This type of carbohydrates are difficult for people with inflammatory bowel disease to digest. This Chron'S disease diet may also exclude grains due to their inflammatory potential on the gut wall. Next, limit the intake of high fiber foods. Fiber, a type of carbohydrate that found in plants, is essential in our diets. It promotes the growth of beneficial bacteria, which aids digestion by bulking up stools and allowing them to pass through the gut. However, while the digestive system can break down soluble fiber, insoluble fiber is more difficult to digest, which causing bloating and sometimes abdominal pain. Many Chron'S patients are advised to limit the amount of insoluble fiber they consume in their Chron'S diet to avoid symptom flare-ups. This is important when there is evidence of narrowing or strictures.